So I do a decent amount of cortisol testing in my practice. I do a lot for myself over the years, but I recommended it to a patient who I just spoke to. And the reason I did is because she's really struggling with energy and losing weight. And she often finds that when she exercises a lot, she puts on more weight and gets fuller in the middle and more bloated. That is a classic sign to me of high cortisol because exercise pushes up your cortisol. If you can't metabolize that cortisol, it causes inflammation in your body, and then you can then store fat a lot more easier. So most people, they exercise and they burn fat, but people with high cortisol, it causes inflammation and they actually store more fat. So I suggested she does something called an adrenal stress test, which is by a company that I use called Genova Diagnostics. You basically spit in little pots throughout the day 6 times, first thing when you wake up, 30 minutes later, about 30 minutes after that, and then around 9 to 11ish, lunchtime, 5ish, and just before bed. And what your cortisol should do is that you should get quite a big increase in that first hour. And then it should go up, but then gradually come down over the evening. And I advise my patient to do the test on a normal busy day for her, when she's going to the gym, when she's seeing friends, when she's out and about. So we get a true reflection of what's going on, not just on like a boring Sunday when she's sat at home in front of the TV. So I find cortisol very useful. The other reason I find it useful is that if you've got quite high cortisol or very low cortisol, if you're taking hormone replacement therapy, it seems to work less effectively because the cortisol is like the all-riding mother hormone. It's basically stealing all your other hormones. So your blood levels might look fine, but you're not feeling the benefits. There are things you can do to manage your cortisol, of course. Some of them are lifestyle. In fact, the most important ones are lifestyle, not just taking a supplement, because if your cortisol's high and it's actually affecting your health, we do actually need to look at your lifestyle. You can't just pop a pill to improve it. But that's something I work on with patients to make it bite-sized and manageable. And I'll give you some tips on that in the next video.